Another common question, I know I've got arthritis, doc. I've seen several other people. Everyone's told me I should have a knee replacement. What happens if I wait? Should I wait? It's important to know that only you that have pain know when you're ready for a knee replacement, but delaying surgery for sure can lower your quality of life. If you used to be a tennis player or a gardener or used to like to ride your bike or take your kids and grandkids to the park or what have you, and you've stopped, or travel, and you've stopped doing those things because your knee hurts, in my way of thinking, I don't see the advantage of waiting another year or 2 or 3 or 4, hoping that something better comes up, or being afraid of complications and that sort of thing. I mean, things go well most of the time, and the results are typically very predictable. And if you're missing out on this period of your life, putting it off until, say, you're 80 or you're 85, well, think of all of that time in the interim when you had the opportunity to travel or what have you, and you passed on it because your knee hurts. So I'm never in my life, and never will, try to push someone to having surgery if they're not ready for it. But I try to encourage people to try to see the bright side, that if you have your knee replaced now, granted it might be a few months before things are normal again, but now you have hopefully the rest of your life to do the things that you've been giving up. So that's one way I look at it. And furthermore, we don't usually get healthier as we get older, right? I mean, as we get older, we start taking more pills, start spending more time at the doctor's office. Every time we go to the hospital, they find more stuff wrong with us. So if you're putting it off, waiting for whatever your particular rationale is, you're not likely going to be in any better shape 5 years from now than you are now. So surgery definitely goes better the healthier you are when you have it done. And furthermore, last point, osteoarthritis is degenerative, meaning that it is slowly progressive. There is no treatment in 2010 that halts the progression of arthritis aside from surgery, and there's nothing that reverses the progression of arthritis aside from surgery. And to be very honest, there's really no research on the near horizon that's going to do that either. I mean, people sometimes come in looking for a miracle cure, and there's lots and lots and lots of research and millions of medical dollars that are devoted to this sort of thing. But there's not an injectable product that's going to be coming out in the next 5 years that's going to stop your knee from hurting. And there's really nothing on the horizon that's, aside from potentially improvement in surgical techniques, that's going to make the treatment of arthritis any better. So maybe someday that'll change, but at least right now it doesn't appear that that's anywhere close to being a reality for us yet. I have a few slides. People always want to know how big is the scar. It really depends. If you're a big person, you typically have a bigger scar. It's just more work to get down to the knee. I'm not exactly sure who this person is, but most scars are typically around 4 to 5 inches in length. You can see that generally they heal very nicely. I mean, you can barely see the scar on this person's knee. We put them, for total knee replacements, we put them right down the middle. And for partial knee replacements, I usually position them off to one side or the other just to minimize the length of the scar and minimize the amount of tissue that I have to go through to get to the knee. This person is not particularly small, as you can see, but this is her range of motion after a total knee replacement. Most people get around 120 degrees or so of a knee bend afterwards, which is typically more than enough to get up from a low chair, more than enough to ride a bicycle comfortably. Most of the things that people do, including even kneeling, gardening, and so forth, can be done if you have this much bend in your knee. And you can tell in this particular person, even if the device would allow her to bend more, she really can't. I mean, there's her thigh and there's her calf. There's just no more room to bend. So this is not always what happens, but this is fairly typical for what happens after a total knee replacement. Here's another person. This person obviously has a pretty thin leg, but there's the scar once again. This is a total knee replacement, goes right down the middle, 4 inches or so, healed very well. Here's his knee range of motion after surgery, pretty good.